Bryan Health takes the responsibility to lead and to do the things that make everyone better, healthier, and moving forward together. Here's another Bryan Health podcast with Melanie Cole.
Today's topic is the prevention of heart disease and the importance of taking your medications as prescribed. My guest today is Dr. Chad Travers. He's a cardiologist with Bryan Heart. Welcome to the show, Dr. Travers. So how prevalent is cardiovascular disease, and are the signs and symptoms and even some of the risk factors different for men and women?
Well, first of all, thanks for having me on this morning. It's a pleasure to be here. Also a pleasure to talk about this topic, which is very important to myself as a preventive cardiologist. First of all, with the prevalence of cardiovascular disease, still remains the number one killer of Americans. 1 in 4 people will die from cardiovascular disease. A person has a heart attack every 40 seconds in the United States, and 1 person dies every minute in the United States from heart disease. So obviously very prevalent and a bit frustrating from my standpoint, because this is an area that we can work in prevention and actually prevent a lot of this. So we still have a lot to do. Getting back to your question about risk factors and gender differences, certainly risk factors affect people differently, or people are at more risk based on family history, and men and women are affected a little differently from that standpoint. But as far as symptoms go, men and women are a bit different as well. Not everyone's the same. Not everyone has typical chest pressure that would alert them to the fact that they are having a heart attack. And the point of this is to get out and reach people and to let people know that, if they are having any symptoms that are concerning to them, that they do seek medical attention.
Based on some of the risk factors we've discussed here today, Dr. Travers, what can someone do to prevent heart disease?
In my practice, I take a 7-step approach that I take. And just to go through them real briefly, first and foremost, one of the things that is most harmful to patients is smoking. And so that's one of the first things that we always talk about is smoking cessation. Next, we talk about exercise. What's recommended by the American Heart is 30 minutes a day most days of the week. And so that adds up to about 150 minutes of dedicated moderate activity per person per week. So that is something that you have to give a conscious effort towards, but certainly something that can decrease your risk. I always talk about healthy diets in the clinic, and I'm not an expert on dietary nutrition, but there are certain things that we will talk about and spend quite a bit of time on. Maintaining a healthy weight is another key component. And then some of the other things that may not be, the top of people's list as far as risk prevention is getting enough sleep. That's one thing that I do talk to my patients about, and stress management. And then finally, what I'd recommend is patients talk to their doctors and get regular screening to look for some of these risk factors.
So, Dr. Travers, if you're on medication, if you have been diagnosed with cardiovascular disease, whether it's atherosclerosis or, something that increases your risk of heart disease and stroke, and you've been put on medication, cholesterol medication, aspirin regimen, blood pressure medication, whatever it is, why is it so important that people adhere to this just as the doctor prescribed? Because I'm sure that you've heard people say they don't, they're concerned about the side effects. You hear them in the media. And what do you tell them about this importance and those side effects?
Yeah, first I would say to that, if your doctor did put you on a medication, there's typically a strong reason behind it. And if it's a blood pressure medication, your doctor wants your blood pressure better controlled. If it's a medication, some of the more high-risk medications that we see in the clinic, I will say, blood thinners, very important. If someone has atrial fibrillation, maybe they're placed on a blood thinner. This is very important for stroke prevention. And, stopping these blood thinners or stopping these high blood pressure pills do put you at increased risk of actually having a stroke or a heart attack. So before stopping medications, I'd always recommend that you consult with your physician first. If you are having side effects, please let your office staff know before discontinuing these medications abruptly.
Give us some tips for compliance, and even especially with the elder population, because sometimes their meds get a little confusing and maybe they're on a bunch of them, including some orthopedic type medications. So, Dr. Travers, how do you advise people to keep track of their medications and to take them as prescribed?
Yeah, it certainly can be quite confusing, especially when a person is on multiple medications, as you mentioned. Many of my patients on multiple medications will have a pill box that they set up on a weekly basis. You can put your pills in there for the entire week, and that way you know if you've missed a dose or missed a day in there. And so I think that's very helpful. Now in the age of cell phones, too, I think that it's easy to set reminders on your phones, on your mobile device, to be able to remind you when to take your medications, and you could even put in there what medications to take, actually.
And that's a good point because sometimes you have multiple doctors prescribing medications. Maybe you've seen an orthopod and they've got you on arthritis medication, and then you've seen your cardiologist who has you on Lipitor and a blood pressure medication. So how do people keep track of the different doctors, and do you all know what somebody else has prescribed?
Yeah, it can certainly be confusing for the patient and also confusing for the provider at times, especially when the patient is on multiple medications. Take these medications out of the bottle. Many of them look alike, and so as soon as they are out of the bottle, it is quite confusing. And so that's why I do recommend a strategy as to how the patient will take the medication. Some people will just keep them in the bottles, keep them in the cupboards, and that's one way they know. But to group them together may be an okay way as well.
There's a lot of questions around aspirin therapy to prevent heart disease in both men and women. And what do you tell people when they ask you about taking a baby aspirin every day?
Absolutely. I think there's a lot of controversy even in the medical community as to who needs an aspirin each day. And so I recommend that you sit down with your doctor and talk about that. I, in my clinic, base it on patients' age and their risk factors. So certainly if a person has heart disease or coronary artery disease, they should all be on aspirin therapy. If a person is diabetic, they're likely to be on aspirin therapy as well. Aspirin is not without side effects, the major side effect being bleeding. So if a person does not have many risk factors and is younger in age, they should likely stay away from aspirin therapy. So the take-home point here, I think, is that each person sit down with their doctor and discuss their individual situation.
So wrap it up for us, Dr. Travers, with your best advice about heart disease prevention and the importance of taking your medication as prescribed if your doctor has prescribed something to prevent heart disease.
I think the biggest take-home point is to know your risk. I think that people should get screens on a routine basis. You should find out if you have high blood pressure, diabetes, or high cholesterol. And you should seek care for these if you do or you are at risk. Maybe you have a family history that's strong for coronary artery disease. And as far as taking your medications, I would just like to stress that the importance can't be overstated. These medications all do have side effects, and I think when we take them on a haphazard basis, those side effects can rear their heads. When taken in a prescribed way, I think patients will be better cared for and better managed.
Thank you so much for being with us today. If you're concerned about your heart health, take our free, quick, and confidential HeartAware online screening at bryanhealth.org/HeartAware. That's bryanhealth.org/HeartAware. This is Bryan Health Podcast. I'm Melanie Cole. Thanks so much for listening.